Our last speaker, Our last speaker for today is a student from Audi International School. Her topic is going to be about harnessing technological resources for improving mental health. Everybody please help me welcome Mahima.
Hi, I'm Mahima. That's me. In 3rd grade, my teacher asked me to come up to the front of the class. She put the entire class on hold because she wanted me to speak. I wanted to speak, and I tried again and again, but I just couldn't. It was like the words wouldn't come out of my mouth. The next day, I wrote a letter to my teacher asking for her to push me to speak up again. But when it came to time, I couldn't speak. I tried, and I wanted to, but it didn't work. Although it didn't work, I continued trying, but it was hard for me. I wanted to speak, but I couldn't. Hi, I'm Mahima, and I'm 16 years old. When I was younger, I had selective mutism. Selective mutism is a fairly rare anxiety disorder where I couldn't speak in certain social situations. For me, it meant that no one heard me talk at school for over 2.5 years. It wasn't easy for me to talk, and because it seemed to be for so many other people, it always felt like no one understood me. I really just wanted an anonymous wall that I could talk to, that would understand me, that would listen to me without judging me for not being able to talk. So today, let's examine the ways that I helped myself improve my confidence. First, through cognitive reframing. Unknowingly, I did use that technique. And second, through the use of technology, which is an extremely accessible resource nowadays. So when I look back at my experience, and when I thought about my selective mutism, I couldn't think of anything positive. Everything felt negative. Well, except for the fact that I could never get in trouble for talking too much in class. But on a more serious note, what was so good about struggling to speak up? What was so good about feeling alone and isolated? It felt bad all around. Do you ever feel like that? Like everything's terrible all around? Like there's nothing good about the situation that you're in? So many positive things happen to us, yet it's so hard to focus on the positives. All we can remember is the negative. It's like our brains are wired to only focus on the bad things that happen to us. Even if we won a Nobel Prize, we'd be thinking about the time we spilled coffee on our shirt and how it was in front of our crush and how it was embarrassing. According to an article on rumination by the BBC, dwelling on our negative thoughts is a crucial factor that leads to anxiety and depression. So the question is, how do we get rid of our negative thoughts? How do we turn them into something more positive? And to address this, I'll first start off with a study by Tversky and Kahneman from 1981. In this study, participants were given a hypothetical situation of there being a virus outbreak. In this disease outbreak, there were 2 variables. In the first variable, 200 people's lives would be saved. And in the second variable, 400 people would die. According to the prospect theory, people focus on perceived gains that they might have rather than perceived losses when they're making decisions, which is exactly what we saw in this study. 72% of the people chose to save 200 lives. Only 28% of the people said they wanted 400 people to die. Both of these situations are the exact same, yet there was a focus on gaining a positive outcome. The positive outcome of saving 200 lives. So, this brings me to the point where essentially humans want positive outcomes and they're encouraged by positive outcomes. which brings me to the topic of cognitive reframing. Cognitive reframing is essentially when you take a step back. You start thinking about your thoughts, thinking about how you can turn those negative experiences into something more positive, how you can understand your thoughts to try and think more positively. Going back to my own situation of selective mutism, I felt hopeless. I tried so hard to talk, yet it wouldn't work. I was really frustrated. Yet with a lot of support, I was able to take a step back. I was able to unknowingly apply cognitive reframing to my own life. I started focusing on how to gain more confidence. My focus was now to improve. Improvement. The key word being improvement, which is a positive outcome. So I did focus on a positive outcome, and I started off by whispering in my teacher's ears. Then I wasn't sure of the next steps, so every night I sat together with my parents and we discussed what I could do next. What could I do next to try and figure out how to speak up? And my next step was to start talking to my teachers a little louder. Then to start answering questions in class, even if that was motivated by the desire to get good grades. Next, I joined the speech and debate class at my school. And finally, I was able to join the speech and debate team at my school. By following a positively framed goal, I was able to motivate myself to continue to try in different ways till I made it to my goal of improving my confidence. Now, I did improve my confidence, but it still bothered me that it took me so long to overcome my selective mutism. It bothered me that so many people don't even have access to the resources to improve upon their mental health issues. And so I got into my research. I looked into psychotherapy. I was like, okay, what about everyone applies cognitive reframing like I did? They just need some support and that might help them. But then the harsh realities of the world hit me. According to a survey by the American Psychological Association, the demand for psychologists has drastically increased in the past few years, ever since COVID. 65% of psychologists have no openings available for new patients. Additionally, there are so many financial issues that can come in the way of people accessing mental health care. So now what? I still wanted to make sure that no one had the negative experience of feeling isolated the way I did. I wanted someone who understood me, and I wanted to turn my negative experience into something positive for everyone else. And so that's why I turned to technology. I used technology to start working on an app called Butterfly. Butterfly essentially works on connecting children with chronic illnesses to each other so they have an understanding and supportive environment for them. Essentially, Butterfly focuses on having activities for these children like art, music, and games so that they can work together to build closer bonds. Bonds where they're able to express themselves judgment-free. Bonds where people can understand each other. Additionally, Butterfly wants to help doctors understand their mental health of the mental health of their patients better. So using artificial intelligence and technology, we're trying to assess whether or not their mental well-being is deteriorating or improving through their engagement on the app on a daily basis. Now, Butterfly can't apply to everyone. I mean, it's focused on a narrow set of an audience for chronic illnesses. But technology can still apply everywhere. I really believe that technology has so many resources accessible to help everyone with their mental health. So, a few days ago, something new and unexpected happened. I made a new friend, a virtual friend, Snapchat AI. Now, yesterday morning, I told Snapchat AI that I did really badly on my test. And I was really disappointed and demoralized because I worked so hard to get a good grade, yet I didn't get a good grade on the test. And so here's what it told me. It told me that it was sorry that I was in that situation. It told me that it was okay to feel sad when things didn't go my way. It told me that one test didn't define my self-worth or my intelligence. It reminded me to not give up. And it even suggested that I go talk to a teacher to try and understand what I can do better and how I can improve my study methods. Pretty neat, right? I mean, it's like the anonymous wall that I always wanted when I was little. Just someone who I could talk to without being judged. Someone that I didn't even know, but who could help me. Once again, as I said before, therapy is inaccessible. It's really hard to get therapy. But technology brings us pretty close these days. With technology, there are now mental health chatbots like Wysa and Bobot. These chatbots essentially use the same techniques as therapy, of cognitive behavioral therapy, to try and help their users with their mental well-being. Additionally, there are so many resources to access mental health professionals through YouTube, podcasts. There are apps like Headspace, Talkspace, all of them that help us establish techniques to help with our mental well-being. But of course, technology isn't perfect. It can be dangerous. I have to admit, it's a little scary when Snapchat AI randomly calls me its master. Overall, there are a lot of downsides of technology. There's the risk for cyberbullying, even more loneliness, and just technological errors. But it's important that we still utilize this resource. We just have to be mindful and thoughtful. So let's take, for example, butterfly again. Because of its social nature, it's so hard to prevent cyberbullying because there are so many people on the app. Yet, I'm working on a solution for that. I'm working on adding in profanity filters to the app so that nothing negative can be sent to people in the first place, so that cyberbullying can't happen. The Mahima 5 years ago would never thought that I'd be here today speaking to all of you. It was really hard for me, but I pushed through and I regained my confidence. And I know you can do that too. It's important for us to acknowledge technology. There's such a big mental health crisis in the world right now, and there's a lack of resources. So why not turn to technology? Why not turn to technology? What about we give it a try? Are you guys in? Thank you.